My name is Dr. Andrew Reynolds. I work at the Breakthrough Breast Cancer Research Centre in London, England. And the work that we've been doing is trying to understand how drugs which target angiogenesis in tumour growth work and why these drugs maybe don't work as well as they might in patients. So we know that for a tumour to grow requires angiogenesis. This is the growth of new blood vessels into the tumour. And there's been a lot of attention on trying to make drugs which are effective in blocking tumour angiogenesis in order to block tumour growth. Now, some of these drugs work quite well. They can actually have some benefit for patients and they can actually block tumour angiogenesis and tumour growth, whilst others have not worked so well. And one type that hasn't worked too well are drugs which target a type of molecule called integrins. Now, integrins are molecules that are involved in cell adhesion. They allow new blood vessels to interact with the extracellular matrix while those blood vessels are growing into a tumour. Now, we've shown that a certain type of drug designed to inhibit these integrins can actually stimulate tumour growth and angiogenesis at low concentrations, and the inhibitory effect is not seen unless we have a higher concentration. And we recently published this work in Nature Medicine. And we think this effect may be important for the way these drugs work, because when you give them to a patient, although they may start off seeing a high concentration of drug, which may be beneficial, i.e. it inhibits tumour growth, as the concentration falls, this may promote tumour growth. And so the net effect is basically a cancellation and essentially a poor ability of these drugs to inhibit tumour growth. We've also looked at the mechanism through which this happens, and we've shown that these drugs can actually change the intracellular trafficking of the integrin target and promote endothelial cell migration and promote angiogenesis.